Hi, my name is Tricia Trinque and I'm a physical therapist at Seabreeze Physical Therapy, and today we'll be talking about how to heal ligaments. Materials that we'll be utilizing today will be an exercise ball and a resistance exercise band. Today we're talking about how to heal ligaments, and after the patient has had adequate rest, elevation, compression, and ice to allow the ligaments to heal properly, we need to strengthen the surrounding muscles. First, we're going to talk about ankle strengthening because it's most commonly the area of the body that we tend to strain the ligaments of. So first what we're going to have Michelle do is to cross her legs, and we're going to put a ball in between her feet. So we're going to have Michelle squeeze the ball with her feet to strengthen the outside of those ankle muscles, which protect the tendons from straining. And release. So we have her squeeze the ball, hold for 10 seconds, release, squeeze and hold, and repeat 10 times. Next, we can have Michelle stretch out on the table. You're going to sit long sitting. Okay. All right. And we'll be taking the resistance band around the sole of the foot. She'll be holding the band with her hand, and she'll be pressing her foot down into the band, giving herself resistance by pulling back, holding for a count of 5, and then relaxing up. This is strengthening the calf muscle, which attaches to the Achilles tendon, which helps to give support to the ankle following a ligament sprain. And repeat 10 times. Again, my name is Tricia Trinque from Seabreeze Physical Therapy, and we've shown exercises to help support the ankle following an ankle sprain of the ligament. Should you have any discomfort or pain, please contact your physical therapist or physician for additional evaluation.